Good evening, everybody, and welcome to tonight's live. I'm Nancy Abdou, founder and CEO of the Australian Dermal Laser Institute, where we provide you all sorts of both online and face-to-face training, no matter the aesthetic device that you have or maybe are looking to purchase. We provide training on not just skin treatments, on collagen induction, but we also provide training on body contouring, which brings me to tonight's topic, which is cryolipolysis. So if you're thinking of getting a cryolipolysis device or a body contouring device, then you've joined in at the right time, at the right place. So if you've joined me on Instagram, hello and welcome. And if you've joined me over here on Facebook or YouTube, welcome. So there are so many things, so many different devices actually out there for body contouring, fat reduction, skin tightening, so many things. But like I said, tonight we're going to talk about fat freezing, or what it's properly called as, is cryolipolysis. So let's first take a look at what cryolipolysis is. Whenever you see the word lipolysis in any type of treatment, you know it just means essentially death of a cell, and cryo being cold. So we're actually destroying a particular cell. In this instance, it is our adipocytes or our fat cells through extreme cold. And so that's essentially what cryolipolysis is. I'm just going to bring up some of my notes just to help me here. So, what have we got? So, cryolipolysis is essentially like any other fat or body contouring device is going to essentially help with pockets of fat. It is not for an overall fat reduction. It's not a overall fat reduction treatment. It is for someone who in generally is fit and healthy and has got a lower BMI. I would say no more than a BMI of 30, and who just cannot shift a particular area of fat, just somewhere where, it's stubborn. It could be, the stomach, or it could be the hips or the thighs or the arms, and they just cannot shift that area. So it's great for pockets of fat, and it also helps because of the trauma that it's inducing. It's also good for a little bit of skin tightening as well, and can be beneficial with reducing cellulite or orange peel. So essentially it is, like I said, for the pockets of fat, but it has other benefits as well. So oftentimes people say, well, how does the device freeze the fat cell without destroying the surrounding tissue, the capillaries or the blood supply, or the skin, the dermis or the epidermis? So essentially, because the fat freezes, I guess, or is destroyed at a different temperature than skin, so fat doesn't take that much more cold for it to be destroyed or disrupted, whereas skin requires a lot more cryo, or a lot more cold, for it to be disrupted or destroyed. And so therefore the surrounding tissue is remained unharmed. I'll come back to that in a second, but essentially mostly it's actually kept unharmed, whilst the fat cell, because it has that lower temperature, so where we can destroy it at the lower freezing point, everything else is maintained in its natural state. Or it is cold, of course, but it's not to the point of where those particular cells are disrupted or distracted. So all of the skin, any of that underlying tissue there, is remain unharmed essentially. So with the fat cell, because of that intense cold, we then destroy that particular fat cell, and once it's destroyed, it's actually permanent. So if you're thinking, or if your client is thinking of doing some body contouring, and they definitely are sure that they're wanting to destroy that particular area, then this might be an option. Like I said, there are lots of other different devices out there, but some people, think or they may desire this particular treatment because they've heard about it. But I think for us, we need to educate them all about it. That's what we're doing here today. So in terms, like I said, of indications, it's, for those pockets of areas of fat, it could be for men or women. So there's no, it can be for either sex. And like I said, for, those who have got a BMI or 30 of less. It's generally painless and it's not invasive, and typically anesthetic is not required. So any part of the body can be treated, except obviously we say we don't treat the face. However, the submental area can be treated with a smaller applicator. So speaking of applicators, there are different sizes and shapes of applicators that can be purchased or come with your device. There are smaller shaped applicators that fit under that submental area just to reduce this pocket of fat there. Or there are different shaped applicators and in varying sizes, depending on the manufacturer, of course, that can treat smaller areas such as the arms, or larger areas rather, such as the stomach or the buttocks or the thighs. So different parts of the body can be treated as well. So that is great. However, there are some, I wouldn't say side effects, but there's a little bit of downtime. And so with this, obviously the sensation of the cold can be a little bit uncomfortable. It's quite tolerable. However, once it reaches a certain temperature, and depending on the size that we're treating, will vary on the temperature, of course, and it is in the minus region, so it's below freezing point. Sometimes people will feel a little bit of desensitization, or they'll lose a sensation in that area, and that can actually last up to 8 weeks. So that's something that obviously you're needing to tell your client, that they can lose sensation in that area. There is going to be erythema and edema in the area, and that's completely normal. That'll last, anywhere from, could be 1 to 3 days. And also that tightness in that area, which is just that inflammation, and that can last up to 3 days. Now, bruising can be seen in the area that's treated, depending on the actual suction, because what happens is the applicator goes on the skin and it sucks up all of that fat, and essentially it's freezing it. So the surrounding tissue, like I said, is kept intact, but the actual fat itself, it's sucked up, or the skin, all of it is sucked up. And so we sometimes might find there's a little bit of bruising in that area. Now, some clients can feel a little bit tired, or they can feel a little bit nauseous for up to 2 days after the treatment, and that's just all the toxins going through and being eliminated by our lymphatic system. Now, depending on how, this sounds bad, but how toxic that particular person is. So they could be someone who doesn't eat well, who is taking a lot of medication or recreational drugs, or someone who drinks a lot. Whatever it might be, the bigger the fat cell, the more toxin it stores. And of course, when those toxins are released into the body, it's not uncommon for people to feel a little bit sick afterwards. So that can happen. And sometimes people might feel a little bit weak for a day or two, and they may also feel a little bit lightheaded. So apart from that, a bit of discomfort and sensitivity to the area can be experienced for about a week. So they're the things that we can expect after a treatment from your cryolipolysis. Now, in terms of treatments and how many treatments and how far apart, we usually say it's a maximum of 3 to 4 treatments. So 4 is like the most you could have. Most people will have about 3. So maximum of 4 treatments, and they're 2 months apart. Each treatment will last roughly from 30 to 60 minutes, and some devices have 1 applicator, whereas some devices can have 2 applicators. I don't know if there's any other device that has more. I think I may have seen one that's got 4. That's crazy. That's just too much for the body, I think. But you can have 1 or more applicators in the one treatment. So roughly 30 to 60 minutes. The results are visible probably in about 3 to 6 months later. And that's when people can actually start to notice a little bit of a change in their fat, or the appearance of their fat. So with that, obviously there's going to be some safety precautions, and I really want to talk about this because I've seen this go wrong. And so it's really important that, if you already have a device, or if you're purchasing a secondhand device, or you're training up new staff, or whatever it is, that safety precautions are taken into consideration, and we make sure we're doing the treatment properly. But first of all, we're always doing our treatment, or providing our treatment on clean, intact, healthy skin. There's no whether it's lacerations, or the barrier is not, it has to be quite healthy and not compromised. Any piercings in the area need to be removed, and really importantly, a membrane or some type of gel, antifreeze gel, needs to be placed onto the skin in order to avoid a freeze burn. And I've seen an amazing freeze burn, and the blister was, I would say, it was just huge, and all because the membrane broke, and the actual applicator was completely intact or touching the skin, and there was no membrane, antifreeze membrane there to stop the epidermis, or to stop the skin from actually freezing. And so then there was a freeze burn. So I've seen that happen a few times. I've had it myself when I was first learning, years and years and years ago, when I first was training on this device, where the actual skin itself was like a block of ice afterwards, and I ended up with a little freeze burn on my back. And again, it was because there was not enough antifreeze gel applied before the applicator was applied. So that's probably one of the most common things that we do see, and that is your freeze burn. So making sure you've got a really good quality membrane, or if the manufacturer's saying to use a gel with some other type of protective cloth on top, whatever it might be, then definitely, let me just cancel that call. Sorry. Then definitely you need to be protecting the skin, ensuring that we're not going to get a burn. Let me just turn this on, do not disturb. Okay, so hopefully I'm back again. There we go. Okay, something's happening on Instagram now. Anyway, I'll keep talking. So with the other precaution that needs to be taken, that is treating on a scar. So, whether it's an old scar or not, and especially a caesarean scar, that needs to be avoided, because that could be made obviously worse. So that is a no-go area over scars. And of course, like I said, with treatments, if you're doing a treatment beforehand, you need to make sure the skin has completely healed before you can go ahead and provide this type of treatment. It is intense. I don't know what's happened here. All right, moving on. So making sure, there's some tips that you need to, that you should adhere to, or things that you should be adhering to. And I've mentioned this before, which is your client having a BMI of under 30, to make sure that, we're going to be delivering a treatment that's efficient and effective, and they're not going to be complaining. I might just quickly restart my Instagram, because it's doing really weird things. Let's try that again. All right. All right, let's see if that's better. So, like I said, making sure that you carry out the treatment on someone who's not already obese. This isn't a weight loss, treatment. It is just for pockets of fat, like I just said. You want to go through your client's medical history and make sure that they are fit, they're healthy, they are active, they drink plenty of water. Lots of reasons for this. One, when we're destroying those fat cells, and that the contents, the free fatty acids and the triglycerides also need to be, along with the toxins, need to be expelled. And if they've got a high fat, high sugar, high carb diet, well, what's going to happen? That especially that energy there will be reused and restored into the body. Where with the lymphatic system, if it's not working optimally, then they're definitely going to be feeling lethargic after the treatment. They might feel sick, and we need to help that body with that process of elimination as much as possible. So making sure they're fit and they're healthy and they're exercising, and their lifestyle is going to support what we're doing. So I think those things during consultation are going to be really important and need to be taken into consideration, making sure that their kidney and their liver can endure what we're just about, the pressure that we're just about to put the the body under, and it can cope with what we're about to do. So looking at diet, their diet's going to be really important. Again, like I said, making sure it supports what we're doing. So, reducing their fat, reducing their carbs, reducing sugars is going to be important. I'm not saying eliminating, but just eat clean and healthy, and making sure, again, that they understand that we're creating a partnership. If we're doing a body treatment, they need to also support us in what we're doing. So we're not reducing this pocket of fat and they're going to eat unhealthily and then end up putting it on somewhere else. All right, so you need to make sure that your client is informed and understands all about its side effects, the complications and implications, and also they need to understand the treatment as well. And so that's, again, all in that consultation process. So, like I said, there's lots of different applicators for different parts of the body. Most good machines will have maybe 3 different sizes for different parts. And in terms of how long it takes, it will be dependent on the area that you're treating. Most manufacturers will tell you to measure using calipers, body calipers, to measure the fat, so you're able to work out your energy or how cold to go and how long the treatment should last for. So again, that's really important that you're doing those pre-treatment checks, so measuring their fat and making sure that the body's in good health. All right. Now, one thing before I go, I wanted to discuss with you what we call paradoxal adipose hyperplasia. A few people, and it's very, very rare, but there are a few people around the world have actually presented with this paradoxal adipose hyperplasia. And what it actually is, and although it is a very rare side effect, it's when we're doing, let's say we've done the stomach, and next to that area, what happens is instead of losing weight or destroying the fat cell there, the fat cells in an adjacent area, close by area, actually enlarge, and it looks like that area has gotten bigger. And although it is rare that for this to happen, it is not even less than 0.0051%, or 1 in 20,000 patients that have been treated that this may happen to. At the end of the day, at the end of the day, it is still a a possibility, and I think we need to make sure that we tell our clients that it is a possibility that this can happen to them. And the only way of fixing paradoxal adipose hyperplasia is through either liposuction, abdominoplasty, or a combination of both. And that is the reality of it, and it's something that both you and your clients need to be aware of. And you know, if they're happy to take that risk, in the consultation form, you should have a little sentence saying, I'm aware of paradoxal adipose hyperplasia, and I'm aware that, you know, it may affect 1 in 20,000 clients, and I will need surgery to remove this should this happen to me. So although cryolipolysis is an amazing treatment, it goes like any other treatment. There is a potential for this side effect to happen, and you know, you need to consider it if this is something that you're providing. So anyway, hopefully that gives you a little bit of insight as to how cryolipolysis works, the benefits, and also sadly that rare but you know possible risk of this happening. There are other devices also that are on the market, and you know, they all have their own side effects, of course, but you know, as much as this treatment is great, this is just the one thing that you need to make your clients aware of. Anyway, enough from me tonight. Sorry about the Instagram playing up over here, but hopefully that give you a little bit of insight. If you need training on cryolipolysis, we're more than happy to provide you with that training, or if you need a refresher training. Of course, the training goes a lot longer than just half an hour or 20 minutes. It generally is a full day of training, and you can contact us by logging into or clicking onto the contact page on www.dermallaser.com.au. I see Pia there. Hello, Pia. I need to respond to your message. It's been crazy. I was training Jess in Sathmarang on plasma fibroblasting today. So much fun. Loved it. But yes, if you need any more information, please get in touch. And yes, I will see you next Wednesday. All right, everyone, take care. Have a good night. Bye.